So, this is an introduction to pain. The presentation has been prepared by Dr. Anurag Agarwal, Vice President of National Association of Palliative Care for Ayush and Integrative Medicine, UP. Pain is perfect misery, and excessive pain overturns all patients, says Dr. Anurag. Pain is more terrible lord of mankind than even death. Thought for us. For doctors and nurses, pain is what patient says hurts. We must believe what patient says, but how many doctors discuss about the pain of the patient is our question. What are the factors responsible for rise in incidence of chronic pain? Rise in the number of NCDs has given rise to the cancer pain also. So, we have people living with HIV/AIDS. There is change in lifestyle, trauma and accidents are there, and a lot of stress leading to degenerative diseases. So, these are causing the rise in the NCDs. Again, there is rise in number of HIV/AIDS patient. The lifespan has increased, unhealthy lifestyle is there, poor socio-economic status is there, and environmental factors as well as pollution again is causing the increased number of NCDs as well as cancer. So, International Association for the Study of Pain has defined pain as an unpleasant sensory and emotional experience associated with actual or potential tissue damage or described in terms of such a damage. It is derived from a 1964 definition by Harold Mirsky and was first published in 1979 by International Association for the Study of Pain in Pain Journal. Proposed new definition is an aversive emotional experience typically caused by or resembling that caused by actual or potential tissue injury. So, this came out in August 2019. What we have achieved? Steps taken towards creating awareness about pain. Pain considered to be fifth vital sign in 1999 by USA. Other vital signs are pulse, blood pressure, respiration and temperature. Pain relief is a human right. The International Association for the Study of Pain and European Federation of IASP chapters declared it on 11th of October 2004. It was the first global day against pain. Acute pain services started in late 80s in USA and in late 90s in UK. International Association for the Study of Pain was formed in 1974. Pain clinic is mandatory in all hospitals by MCI and NABH, and basic training in analgesics is a must for all physicians. As a fifth vital sign beyond temperature, pulse, respiratory rate and blood pressure, pain stands as a fifth vital sign. And you can measure pain by visual analog scale, which is also known as VAS. So, here we can see this is a 10-point scale, where we have no pain, mild pain, moderate pain and severe pain, very severe pain ranging between 7 and 9, and 10 is the worst possible pain. It is important to measure the pain every time you measure vitals of the patient. What if pain is not relieved? Physical impact could be tachycardia, hypertension and even cardiac problems may be there. Increased oxygen demand is there, respiration is compromised, pneumonia could be there may be delayed wound healing and deep vein thrombosis. Psychosocial impact is also there, prolonged state of stress, there is depression, there may be anxiety, there may be non-compliance and pain can certainly kill. So, people can be tempted for even suicide due to non-treatable pain. So, it leads to fear, depression, anxiety, frustration and worry. Burden of cancer pain. Almost 30 to 50% of people with cancer experience pain. 70 to 90% of people with advanced cancer experience pain, and 1/4 of the cancer patients experience 2 or more types of pains. So, pain due to cancer is almost there in 78% patients. Pain may be associated with cancer treatment in 19% of the patients, and pain unrelated to cancer or treatment is only 3%. New statistics were released on the first Global Day Against Pain, and they indicate that 1 in 5 people suffer from moderate to severe chronic pain, and that 1 in 3 are unable or less able to maintain an independent lifestyle due to their pain. So, burden is enormous. What it is necessary to study pain and its treatment? Patient reports to the doctor only if he/she has pain. Pain is the main complaint in 80% of the patients who report in OPD. Pain is the first sign of underlying infection, inflammation and other pathology. Pain, if not relieved, has dire consequences including death. Pain, if not relieved, leads to suffering. Pain, if not relieved, can become total pain, affecting psychosocial, spiritual aspects of the human being. Unrelieved acute pain can become a chronic pain which is difficult to treat, and research shows that unrelieved pain negatively impacts the patient in every way. It could be socially, physically as well as financially. Some facts about chronic pain. Chronic pain is in itself a disease. Pain lasting for more than 3 months is termed as chronic pain. It is a condition that carries an enormous economic burden. Chronic pain is leading cause of disability and a major contributor to rising health care costs. People in older age groups and the lowest income brackets are the greatest risk of a chronic pain condition. Chronic pain is related to stress and mood disorders. Other symptoms develop including anxiety, depression and sleep disorders. IC's and IASP's declaration on chronic pain as a major health care problem and a disease in its own right. pain and palliative care. 80% of the cancer patients have pain as main symptom. 50% of the HIV/AIDS patients have pain as main symptom. 90% of the cancer patients in advanced stage of disease, they have pain. 25% of patients receiving palliative care have severe pain. A systematic review reported a prevalence of pain at 20 to 78%, median was 41 in chronic heart failure patients. 21 to 77%, median was 68 in chronic obstructive pulmonary disease patients, and 21 to 64%, median was 52 in chronic renal failure patients. Hence, always treat a pain before it is too late. Thank you.